Hello, I am Dr. Apurva Pande, consultant hepatologist at Aster RV Hospitals, Bangalore. I have done my DM in hepatology from the Institute of Liver and Biliary Sciences in New Delhi. I will be discussing about fatty liver disease. So, what is fatty liver disease? It is the accumulation of fat in the liver, basically the liver cells or the hepatocytes, which leads to the inflammation, fibrosis, and subsequent shrinkage of the liver parenchymal tissue, leading to cirrhosis. Now, who is at risk of having fatty liver disease? Fatty liver disease occurs most commonly in diabetics, obese people, those who have a higher intake of refined carbohydrates. It also occurs in alcoholics, but that is a separate entity. Talking about the prevalence of fatty liver disease, it is estimated that about 35 to 40% of the population of the world is affected with fatty liver disease. In India, the prevalence is around 35 to 40%. How is fatty liver diagnosed? Are there any symptoms of fatty liver disease? So, unfortunately, there are no symptoms. The patient usually comes to know about the presence of fatty liver when an ultrasound abdomen is done for an unrelated disorder. During this time, the report usually comes as the patient having grade 1, 2 or 3 fatty liver. Upon evaluation, we find that in a certain group of patients, there is an abnormal LFT. Another important question is, are the liver function tests always abnormal in fatty liver disease? The answer is no. The liver function tests are abnormal in certain patients who have severe inflammation and there is a tendency towards the fatty liver disease or NASH. Who is at risk of developing fatty liver disease? The fatty liver disease is most common in obese patients, diabetics with uncontrolled blood sugar levels, in patients who have higher triglycerides levels. It also occurs in alcoholics, but that of course is a different entity. Now, whether the fatty liver disease is inheritable? The answer is yes. Certain genes have been identified which lead to the inheritance of fatty liver disease in families. So, it is advisable that if any of your family members is diagnosed to have a fatty liver disease, make sure that all the members undergo a screening for the presence of fatty liver. What is the treatment for fatty liver disease? The most important treatment for fatty liver disease is lifestyle modification. We should maintain a healthy body weight. The diabetics should maintain their blood glucose levels within a normal range. We should avoid the intake of refined carbohydrates. We should follow an exercise regime. A commonly asked question is whether there are any drugs to treat fatty liver disease. There are drugs, but they should not be taken without the specialist's advice. So, we at Aster RV Hospitals have an integrated liver care team which has experienced hepatologists and skilled transplant surgeons who can take care of all the liver ailments. Thank you.